Yeah, I know.
Okay.
After 30 it changes.
Let's go ahead and start because there's a couple more people that's gonna come in, but they're running a little late. Today is April 10th, 2024. We're gonna do our in-service on just like our roles, right? AM, PM, CNA, expectations. You know, like you've had a lot of not really complaints, but I guess we'll call it complaints then. You know, when AM shift comes in, they'll have certain things they're gonna say, hey, you know what, knock shift didn't do this. When PM shift comes in, you know what, AM shift didn't do this. And then when knock shift comes around, there'll be some same complaints, right? Like, you know what, the morning shift didn't do this, right? So we're gonna go over some of the things that we should know, right? In the morning and PM shift, primarily as a CNA, what do we need to remember as a CNA so that way we can carry out the roles that we need to be doing so to prevent issues from the next shift, right? Orientation. When you come in the morning or even PM shift, right? Any shift in that matter, you should know your resident's orientation. And how we do that in terms of residents is that we're just trying to figure out the patient's oriented times 2, times 3, times 1, times 0, right? That means that if the patient is not oriented, they're confused, right? And we can get their orientation just through day-to-day conversation. You have a new admit and you're talking to the resident and you ask them, you know, names, right? You know, do you know your name? You know, they're gonna know their name. Do you know a certain, you know, the president's name? You know, do you know the date?
Isn't it
right?
like the number 4 scale? Name, their orientation, there's like you ask them like what you're saying, the name, and then where you live and what's your birthday.
Yeah.
Yeah.
Yeah. So you can actually, if you don't know if the patient is confused or oriented, and you're not trying to like
Conversation.
look like a fool out there, you can carry out this conversation. Hey, Mr. Whatever Smith, how you doing? Do you know where you're at? Right? If you admit, do you know where you're at? If they tell you, if they know where they're at, they're oriented to place, right? You can ask them the time. If they know the time and the month, they're oriented times 2 now, right? So they know the time and the place. If they orient to situation, do you know why you're here? If they say, I don't know why I'm here, they took me here, and I guess I'm on vacation, right? Instead of saying, hey, you know what, I have a hip fracture, I'm here for a rehab, right? You can know they're oriented times 3 if they say, I'm here for rehab because I broke my hip, okay? And then you can say, you can ask them, you know, who's the current like president or something like that. They say, you know, I don't know, Barack Obama. Okay, then they're not oriented. Right? If they say Joe Biden,
Jimmy
right?
Carter.
Jimmy Carter, right?
Because then they're
So those things right there will tell you whether they're oriented times 4. Okay. So the way that's important is because then you can carry a conversation with these residents. Then you can do the things that you need to do with these residents, right? If they're confused, oriented times 0, then a lot of times you have to make a decision for these residents, okay? You still have to tell them, hey, Mr. Smith, I gotta do this for you, okay? Even if they're confused. Okay, I'm running out of battery too. So we just gotta make sure that that orientation is really important because now you can carry out the goals that you need to do based on their level of orientation, okay? The other thing that you need to do before you start your shift is you should probably know the transferability of these residents, their requirements, right? Do they need 2-person? Do they need a Hoyer? Do they need an easy stand, right? Why do they need that? Do they have a knee fracture? Do they have a hip replacement? So those things are really important. Okay, special needs and ortho needs, right? They might need an AFLO, which is a orthotic type of devices that will strengthen their legs, right? And these are devices that you can add on to add strength to their knee, to their ankle, right? You might need those braces and TED hose, right? TED hose, foam sleeves, right? Foam sleeves generally is to protect your arm or your legs from bruising, right? There are other things out there like the Jerry sleeves that will protect you from scratches as well, right? So we just gotta make sure that those things are kind of in place before, you know, when you're starting your shift. Yes, ma'am.
Question. So do we have those resources available here?
Yeah. In terms of how do you find out, or you mean of like the equipment?
Just if we know we need foam sleeves, where do we have?
It's usually in the
enough
room
foam
already.
sleeves? Okay.
Yeah. When we order it, we get it from our storage supplies, and it'll be in the room.
Okay, so
Yeah.
it's something that comes specifically to
It'll be
that
on your
patient.
POC and plus it's already charted.
Yeah, it's on the matrix too, right?
Yeah.
When you're charting later on, now before you start your shift, it's great to be able to have time and check your resident, but you're not gonna have that time. You're gonna go to work right away. So a lot of times the information that you're looking for might be available when you're charting. So it's good to kind of just chart as you go. You know what I mean? We'll go over when it's considered late time for charting. Okay. But yes, those things should be available in the room already. Okay. We're not gonna have an order that says put this on and then it's not gonna be available. You know, sometimes it will, or like, but it shouldn't be. Okay. So like for example, braces and stuff like that, AFLO, all these ankle
Like
strengthening
if
devices.
if they get misplaced, then do we just let the nurse know? And
Yeah.
they have to
Right.
order it on behalf of the patient.
Absolutely, yeah. Communicate with your resource nurse to make sure that, hey, you know what, these are not in there, there's an order for it, you know, let's get another one, right? A lot of times too, Blanca, who's the clerk up front, will communicate with our staffing supplies and they'll try to order it for us. Alright. Also, Foley catheter, you know when to switch the leg bag to drainage bag. So Foley catheter, if they're in bed, you generally want the drainage bag, and it's gotta be beneath the, you know, when they're laying in bed, it's beneath the bladder, right? So that it's draining appropriately. When they're up and walking, going to the dining room, you should change the drainage bag to a leg bag, okay? So don't, it's a dignity issue. If the resident's walking around and they have a drainage bag, you can see it's on the wheelchair, we're gonna get dinged for that when the surveyors are coming in,
You
okay?
have a coverage bag, a dignity bag that goes over them.
You gotta cover it. If a patient doesn't want the leg bag and they want the drainage bag, just have it in a dignity bag. Okay, it's gotta be covered.
Can I ask you a question?
Yes, ma'am.
Do you guys still had to wear gown when you changed the stuff here? Cause
Yeah.
I think they put it in effect like last year and.
A resistance,
Yeah.
people, that's what the.
You work in a skilled nursing?
Six.
No, I work
The
at,
next question.
it's, home care.
Oh, okay.
Yeah.
And they teach you that, huh?
No, I observed you when you picked the paper up and I just wanna know, cause it's been a while since.
Oh, okay. We're gonna talk about that right now.
Yeah.
Yeah, that's why I'm asking. so
Yeah,
that's
yeah.
such
So a lot of skilled nursing will have this. Some skilled nursing they don't implement it.
Yeah.
It's whatever skilled nursing you go to.
Yeah, but, you just only do it here, but not assisted living,
Yeah, this is a skilled nursing thing.
only
Yeah,
skilled nursing
skilled
thing,
nursing,
cause I don't
yeah.
see that having a assisted living.
No, that's a
before.
completely
So,
different
yeah.
thing.
Just wanna make sure, 'cause
Yeah.
I'm like over there, they're like, no, we don't need you to wear that, I'm like, oh, okay.
So this is best practice
Uh-huh.
to prevent infection. You can do it. It's not required. It's just what is best practice.
Yes.
Okay. So yes, know the importance of number 6 in patient's room. When you see number 6 outside the patient room, that means they have either a Foley catheter, which in this case we're talking about a Foley catheter, right? Or somebody might have an IV, or that patient may have had a history of a superbug. Okay. So superbug. So the number 6 means the patient is at really high risk for infection, Foley catheter IV, or has a history of a MDRO, which is a superbug, right? MDRO meaning that there's a very little amount of antibiotics available to treat this infection, and so that's why we wear gloves and gown for these residents with a number 6. So know the number 6. It's just
MDO, right?
MDRO. Okay.
RO.
Oh, okay.
Okay.
MDR,
Resistance.
multi-drug resistant organism, okay? Okay, and then also patients might have an IV. Know the reason why they have an IV. It's just for your own reasoning. You know, a lot of times patients are on antibiotics, IV, right, to treat an infection. So you might want to know that. So it's not gonna be available to you right away, but as a CNA, you should definitely want to know that, right? You're taking care of this patient. Because it could be a difference where a patient is taking IV, it's just for hydration, and then or a patient is taking antibiotics for MRSA, right? Two big significant things. It may seem like it's not a big thing, but as a CNA taking care of the resident, you should probably know that, right? So know the reason why they're having an IV, because it's for your own protection. It's also, it benefits the resident when you know that, all right? Another thing you should know as a CNA when you're coming in before your shift or when you're starting your shift, either AM or PM, where should you be during mealtime, right? For AM shift, you're providing meals to resident for breakfast and lunch, right? At 8 o'clock and at 12 o'clock. And then for PM, it's obviously 5 o'clock. But there's there's places where we are assigned as a CNA, right? For example, you could be in a dining room, right? In the where residents require assistance, right? Dependent dining room. You could be in the hallway, right? Or you could be in the independent dining room. Each one of those roles as a CNA, you're doing different tasks, right? On the floor, obviously, you're gearing up, you're passing out the trays, you're making sure that patients get the right tray, and you make sure that it's seated upright, and you're also taking residents to use the bathroom, right? And it's different for CNAs that are in the dining room who are assisting with meals, right? And then in the independent dining room, it's totally different because you're monitoring the resident when they're eating. So kind of know where you're at in terms of meals when you're starting your shift. Showers. There's a few things to consider when during showers. All showers are documented and signed off by nurses. So that means that if you have a shower, whether a hospice personnel gave the shower or you gave the shower, we gotta sign off on that document. Okay, that shower was given. Okay, also on Matrix, it's gotta be signed off, right? Even if a hospice personnel gave the shower, especially if they give the shower, we wanna note that they gave the shower. Okay, so we all know that there's two places you have to sign off when there's a shower. There's a form that you have to write in, and there's also a matrix that we gotta note that the patient did get a shower.
Matrix, you mean like, when we're documenting?
When you're charting, yeah, on the
Charting.
computer.
Okay.
Yeah, so we also chart on there, because under shower, you can put in their shower given, and then you can, and because hospice gave it, there's also an option that an outside, vendor gave the shower. So we wanna make sure that those are noted, okay?
It
All
shows-
refused showers are signed off by nurses. So if it's refused, you wanna make sure that the nurses sign off on it, and also that the bed bath is offered at that point, okay? So what are some of the steps that we can take when patients refuse showers?
Shower sheet.
When a patient refuses it, how can we be efficient to try and make this resident go take a shower, right? You can return back multiple times, we can offer multiple times, you're really feeling better a little bit later, right? You can offer shower at a convenient time, maybe it's too cold right now, right? And they just woke up, you can come back around noontime, see if they can get a shower, right? You can have a nurse to try to help you, and then, or you can have another CNA to kind of help you that's really good with that resident, or we can call the family member to try to see if we can give this shower for this resident, right? Because we can't go on and on and on days and weeks and months with this resident refusing shower, because that can get us in very big trouble.
Do you
Okay.
have a resident who refuse shower?
Yeah.
Oh,
do.
gosh,
Yeah.
all the time.
in assisted living is a little different. Yes, ma'am.
When a resident has been refusing showers,
Mhm.
and the family should be notified on that, things.
Not all the time, but
So
it's
when-
difficult.
But when do we escalate it to the family that we can say, okay, can we assist us because the resident has refused multiple times for showers? Like
That's a
when,
very good question. Okay, so if you're working here per diem, you're not really gonna know that situation. If you're working here full time, right? And you're like, hey, this is the third time he's refused showers. Also, the nurses should be aware of that as well, right? This is not only on the CNA, but it's like the whole team. The CNA, the LVN should be talking about it. Our team should be talking about it on a day-to-day basis. But if you notice that it's been like 2-3 times now that they refuse, you want to escalate that to the nurses and say, hey, you know what, maybe let's call the family members. It's been, this is the 4th week that he's haven't taken a shower. So we want to make sure that, and that's when we can call the family member. Hey, refusing one time and then taking a shower the following week, it's not going to be significant. There's some residents out there just don't want to take a shower every week. But if it's going on for multiple weeks, obviously we want to step in,
so
right?
just relate it to the nurse. and then the
Relay
nurse
to the
will know
nurse,
it.
and that's why that
That's the
signing the form is going to be really important for them to kind of sign off on. And then because that gets communicated to our meeting, we have a meeting every day basically on all of our residents, right? And we talk about certain things that are not being followed through, and the shower is one of them. When if a patient has gone through 2-3 weeks without a shower, we're going to talk about it in our meeting. We'll get the family members to come in. We'll have a care plan. Okay. Snacks. There's another thing is snacks. There's snacks that are passed out at 10 a.m. and 2 p.m. and I believe there's some at like at 10 p.m. But the 10 a.m. and the 2 p.m. snacks are the ones that are like not passed out frequently. So when you're working AM shift or PM shift, mostly AM, you wanna make sure that at 10 AM, you're looking at the snack, container, okay? If the snack is passed out and the patient, and you have to help your resident actually eat the snacks, right? You gotta know their matrix, how much in percentage wise, how much they ate. If they refused it, you gotta put in there that they refused, right? You can throw it away. In fact, that's what we need to do. We need to be throwing these snacks away if they're not eating it. We can't leave it there because, hey, the snacks was prepared every day, 2 times a day. If we're not passing it, it's accumulating, it's just piling on. It looks like we're not doing our job, you know what I mean? And if we, even if the patient is refusing it, we can either decrease the snack or just remove it basically, okay? If we think about why these patients are getting snacks, because they're losing weight, they're diabetic, they really need these snacks, okay? So you gotta know their matrix, and you gotta help your resident with
Dietary
snacks.
sheet out there too,
Yeah, there's dietary sheets out there for
that
the
we
snacks.
initial.
Okay. All right. When things break down or broken equipment pose a threat, how do we fix these equipments?
We have a
Broken
worksheet, a
wheelchair.
work ticket.
At the nursing station, there's a work ticket, okay? And equipments can get fixed through a maintenance department, but we gotta do a workup on it. We gotta do a list on it. We gotta fill out those lists in order for maintenance to be able to fix it, okay? Certain things that our nursing crew can fix, like let's see, what can we fix? We might just need to order it. So nonetheless, just make out a work list for it, work order for it. If they can't do it, they're gonna say, hey, you know what, that's a nursing thing. Either Gurley or Viviana will try to buy and order something for it. And so just make out those slips for anything that's broken. Okay.
Change of condition.
Next, I think that's next. How to report change in condition. Okay, so how do we report change in condition? When you have a patient that's usually, I don't know, maybe has a fever, right? And have a history with a nurse review. You reported to the nurse before and it's never been carried out, right? They're like too busy, they forget about it, right? And remember, when there's a significant issue like a fall or something like that, we've lost nurses in the past because patient fall, they reported it, the nurse don't make an event, patient actually has a fracture, and we end up losing nurses, okay? So make sure that when you're reporting something, if you feel that's not gonna get carried out verbally, you can write them down. The same, at the nursing station, the same thing with broken equipment,
Change of
there's
condition.
also a change of condition form, okay? That means that if a patient has changed condition, you can verbally say it to the nurses passing meds, but you can also write it down, the change condition, and give it to the resource nurse. Hey, this is what's going on, I have a fever, I verbally told it to the nurse, and you gave it to the resource nurse, and now you have a basically,
So when you
written
do
order,
the
a written
condition form,
documentation.
is that on the computer charge or you writing a actual form?
As an actual form.
Okay.
As an actual form. Yeah. We're very limited in what we can do with a computer, right, in terms of reporting.
So the form will actually say change of condition.
Yeah.
And then
Yeah, yeah,
they give it to us. And then, are there 2 signatures, like do you sign and the nurse signs, or what happens?
Yeah, you have your signature in there, and then basically you give it to the resource nurse, and if the resource nurse is not there, you can put it in my box. At the nursing station where all the charting papers are at, I have a box there, you can put them in there.
So
Okay, so
just-
if anything falls apart, you can say, hey, you know what, I verbally said it to the nurse, that there was a change in condition, they didn't follow through, I even wrote it down. So you can basically write down and give it to the resource nurse, and then, or put it in my box, okay? So but here's the thing, when you have the change of condition, you have vitals and everything else that's in there. When you put the vitals in, the nurses actually see that on the computer, that there's a significant change. Fever, high blood pressure, low blood pressure, they can see that. Low oxygen, high oxygen, or whatever the case, not high oxygen, but low oxygen, they're able to see it. So,
So same thing would be like for a bruise, you wouldn't be able to see that on the Bible.
for the bruise, yeah.
But in that case, I'll document it. I
Yeah.
said new bruises or a new wound or
Right.
whatever.
Right.
then
Most
the-
bruises are already noted, and there's likely an order for it already. You can verbally say, hey, you know what, there's a bruise there. If it's a significant bruise, you know, looking like it's new or whatever, and you're not gonna know that either, but just to make sure, I would just write the form. You know, especially after a shower, when you're doing your assessment and you see a big bruise on an open area, the nurse might say, hey, you know what, there's already an order for it. in that situation,
But
there's
I
not much.
wouldn't know that.
But you
At
wouldn't
least
know
she
that,
knows.
yeah. So, but you
Right.
can write that form, and you can note down
I
exactly,
just put in.
and just put it in my box or give it to the resource nurse. Yeah, just say that, hey, you know what, I already told the nurse that's passing meds, but I'm also gonna give you this, change of condition form because this is what I saw after giving you a shower. Okay, so it makes everybody liable, right? Especially the nurses on the floor. End of shift. All right, any questions on that? Okay, end of shift. Make sure all rooms are clutter free. This one is seems really easy, but this is the ones that everybody kind of complains
Is
about.
that number 8?
This one you might not have on that.
No, we
Okay,
don't.
so, end of shift report, guys, remember that we're making this in service because there's complaints from AM shift about knock shift, there's complaints about AM shift from PM, all shift has their own thing, right? And it doesn't have to be that, hey, we did something wrong, it could just be that, there might have been, a registry that was working, or maybe somebody went home early, or it's just that we're basically have a different mindset. Okay, so for example, end of shift, right? End of shift. Make sure all your rooms are clutter free. What I see a lot all the time is that you have a wheelchair that has these
Like rest?
leg rest, right? Instead of putting it like on top of the wheelchair, right? It's kind of just on the floor or somewhere in the chair. You have extra linens that's kind of like this high. The beds maybe is not made out. The resident's been up since 12 o'clock, and you come in and there's extra linens everywhere. Maybe you come in and the chucks are way up here, right? And the bed is wet. Maybe on your last shift you pulled the resident up and the truck went all the way up. And I get those complaints all the time, unfortunately. And so you just want to make sure your rooms are clutter free because that decreases the incidence of fall. Your beds are all made out. Remember that housekeeping will empty out your trash and they will leave the trash in a bag on the floor next to the trash can. It is our job to empty that. Okay, it's our job before you end your shift to empty our trash can within the linen. And then also, no,
Like,
but also,
'cause we know better.
but also the linen bags. You want to empty the linen bag before you go home. Okay, so this creates a good environment for every shift, right? If I'm on AM shift and there's 8 CNA and 5 CNAs didn't empty out their trash, right? Even though the 3 CNAs did, it's gonna make it seem like, wow, what a crappy shift AM shift is, right? So it only.
I once in a while work in person in skilled nursing. It just after they clean it, usually they clean it right like 15 minutes before. But sometimes the resident they just need to go and it just happens to fill up again.
It does, and it's our job to really empty it before we go home.
You
from
still have to go
the
back
day.
and check again.
No, so here's the thing, when it comes to trash can, right, your trash, right? If you change a resident, had a bowel movement, and you left it in your trash can, that's gonna stink up your room, your hallway.
No, I'm talking about just wet brief.
Oh yeah, the wet brief, there's not much, there's certain times that you do your last round. Okay, so here's the thing with people, right? And with urine, you can tell the urine's been sitting for 8 hours, guys. Okay? I can tell if urine's been sitting for 2 hours. I can tell if the urine's been sitting for 10 minutes. Okay? That diaper holds a certain amount. So if you pee, it's gonna saturate some parts of your diaper. Now if you sit there for another 8 hours, you're gonna change, you're gonna pee more and it's gonna come out more.
Plus
Okay.
the gel starts
So
coming
if it starts getting into the bed, depending on the color, it's been sitting there, you can tell how many hours you've been sitting there. You know what I'm saying? So a lot of nurses have been here for a long time to be able to tell that. And so when we come in and say, you know what, I did my last round, it could have happened within 15 minutes ago. Unfortunately, because we've been playing this game for the last 18 years, I know if the urine's been sitting there for either 1 hour, 6 hours, 8 hours, 16 hours. Okay, so we need to be very careful about the situation of, yes, I did change. We know, like, whether you change this resident or not. Unless the patient really gush out the 6 gallons, and then it's just kind of like everywhere. But we know how much diaper really saturates, right? And you can accumulate that in one part of your diaper. But for 8 hours, that could come out through here, 16 hours, etc.
Wouldn't that
Okay.
also adds to more rash and?
Yes,
more,
absolutely. Skin breakdown,
breakdowns?
right? Bed sores. That's how you get bed sores everything else, skin related, okay? Resident bed should be pulled up and check should be appropriately placed and not under their heads. Okay, charting should be completed 15 minutes after your shift ends or else it becomes late, right? So for example, if your shift ends at 2:30, you have another 15 minutes to complete your charting or it'll be late, okay?
So 15 minutes before, after?
Yeah, 15 minutes after your shift
Like
ends.
worst case scenario, but
Yeah,
if you can do it in advance, then you, that's.
Right, right. So as you're, especially bowel movements and urine and all that stuff, outputs, inputs, you gotta put those in as you go about your days.
Yeah.
Okay, so put those in and then don't wait around because at the end of your shift, it's gonna be late, okay? Just kinda just how, that's how it goes. Communication with registry, okay? So, the best way to communicate with registry is the verbal, is if you're kinda just running around and they're asking, hey, how do I get my residence up? Okay?
We have a cheat
The
sheet
quickest way
there.
to kinda just help them out real quickly before you go about doing your shift is, let them know which residents are oriented. You have 8 residents, these are oriented, this is confused, this is oriented. That's gonna really help them communicate with their resident. You can tell them this is resident is usually in the room for their meal, right? Or this resident is usually in the dining room, right? You can tell them are they continent? They're usually continent, so or they're usually incontinent. So make sure you check in them 2 times a shift, right? That's a big help, right? Mobility. How much assistance do they need? They're gonna need Hoyer lift. They're gonna need easy stand. They're gonna need 2 person. 1 person is fine. This person is able to stand up on their own. Those are significant information that they should be able to know, right? And then after that, you're just like, hey, you know what? I'm really busy. I gotta go do my own thing. If you need any more help, come and get me, okay? So, but with those simple things right there, that can help them out significantly,
Plus,
right?
we have a cheat sheet.
Orientation,
Yeah.
where they
Yeah,
should be
that's
for
what I said,
meals,
cheat
their
sheet.
continent level, and their ability to move around. And in the cheat sheet, you're right, right?
And show them where they,
And give them a radio
our
so they can
walkies
call
are
us.
at.
Walkie-talkie, right?
Well, that is,
Is that,
if
the
people
cheat
they
sheet
can
is
write
that
their
on
own
the
notes.
breakdown
Like,
of the
okay,
contract?
Yeah,
Get
it's
the
every
non-resident
resident we
resident.
had, and then on the side, it'll tell, like how you said, if they have a, the TED hose, and how they get up, and how do they,
Usually RNA does that.
mobility, and then where
Yeah.
they go in the
Stop
dining room,
doing
or
what
what
we're
dining
doing.
room,
Get
and
behind John.
The RNA a lot of times will help
Nobody's
out.
ever heard of it.
No,
You go to Madam John.
I just
Yeah, yeah.
learned that yesterday.
Oh,
Okay,
okay.
how many people are on?
So, last couple things here, guys, we're gonna finish up here, because I know you guys have to leave. The beds and safety, beds should be low, be a low position. Don't leave your beds too high up, okay? A lot of your patients that are confused should not have their beds way up here, okay? Should be at the lowest position. Some residents have bedside mat, we should have those in place when it's ordered, right? Bed remotes and TV remotes should not be wrapped around the bed, right? Beds also should have a gap between the walls, right? We've had in so many
Or their
occasions now.
neck, I like the other day.
On their neck.
When did we see it? Was it was me and you, Zach, right? We saw the cord, it was 6 feet, right? We saw the cord across his neck.
Yeah.
Oh, yeah, John.
Alright, so you guys, you just be careful, we are, making sure that, you know, in terms of safety, we don't want those things kinda wrapped around. Should have a gap. Forest resident, or, we'd order for bat, we talked about that, should have those appropriately in place. Okay. I have in here AMCNAs as well, what is this? AMCNAs, grooming, dentures, you know, these are pretty simple stuff in terms of like dentures, how to apply dentures, you should have this paste. How to dress residents for weak side, resident with weak side, left side weakness. Which side should we put the clothes on first? The weak side, right? And then when you're taking it off, which side do you take off first? Strong side. Okay, so that's, you know, pretty common, right? Even our new CNA should know that. What becomes confusing sometimes when you actually do the actual job, right? When you're in place and things are going really fast and you're just like, okay, what do you do here? Sometimes we tend to forget. Our resident that's sitting up in a geriatric chair or wheelchair, we gotta get them positioned in a way where it's comfortable. When we're passing by residents, it's our resident and they're kinda slumped over, you want to be able to reposition them because they're probably hurting and they're trying to move around like this and try to reposition. So don't leave your patients that are not able to move on their own for more than 2 hours in that chair. Move them around. Okay. Therapy. Most patients in the South Hall, they have therapy. right? And therapy yells and screams at me all the time that, hey, your patients are not ready. How come you're seeing them not getting ready? When do we get these residents ready?
In the
morning.
AM.
In the AM at what
Before
time?
breakfast.
Before breakfast, we get them.
Before or
Yeah, get
after
them in
breakfast?
Yeah, get them ready.
Depends.
So if you're working an
I
AM
always get
shift,
mine
get
before
them ready
breakfast.
before 10 a.m., right? It could be after breakfast, it could be, there's
So
some
before
residents out
10?
there that refuses to get up, right? The minimum you should do with
What time does
patients.
therapy come here?
Usually around 10 o'clock, around 9 or 10.
But
The
before
minimum
10.
we should do for these residents is get them dressed
Right.
in bed, right? You don't want to get up from therapy, man. I want to get you kind of ready. Communicate effectively, right? Don't be yelling at the resident. Obviously, you're never gonna win if you're raising your voice. Okay, just get your points across. Just be like, ma'am, I gotta get you ready. Therapy's gonna come in pretty soon. If you don't want to get up, at least let me get you kind of dressed up. Okay, get them dressed, keep them in their bed, so that when therapy comes in, at least we've done our job, right? If they're usually having pain, you want to ask for pain meds. Those are also important. We talked about this already. PM CNA is important. Info prior to PM shift. You want to get your reports. Admissions are usually done in PM shift or mid morning. So get your report from either the resource nurse or the nurse passing the meds. If you can't get the report, at least get the orientation of the resident. Talk to your resident and get the level of orientation. Know your shower and vitals. Obviously, prepare residents for PM dinner. And then some residents do well showers before meal. Obviously, it would be good if they like their showers after their meal, their dinner, because then you can just get them ready after a shower. But again, those just takes communication between you and the resident. Okay, but for the most part, the AM and PM has pretty much the same thing. The only difference, the significant difference, is that residents of the PM are high risk for falls, and these residents that are sundowning with Alzheimer's, we want to make sure we're monitoring. We want to know the 4 Ps. We want to monitor for pain, positioning, are they thirsty, parched, and then